On tonight's news, I'm Gabe.
And I'm Asif, the lead anchor at KGW7 Portland. Today's top story is about pancreatic cancer. As we all know, we have recently lost Justice RBG due to pancreatic cancer. What is pancreatic cancer? How deadly is it? And why you might be next.
That's right, Asif. And today, we dive into one of the most deadly cancers to exist.
The pancreas is both an endocrine organ that secretes hormones that control blood sugar, as well as an exocrine organ that secretes digestive enzymes to aid in the breakdown of food. Pancreatic cancer is the formation of a tumor in the head, body, or tail of the pancreas. These tumors can be localized to the pancreas or metastasize to other parts of the body, such as the stomach, spleen, liver, gallbladder, and intestines. Geez, Gabe, that was a mouthful, wasn't it?
Yeah, wow, that's crazy. According to the National Cancer Institute, the 1 year survival rate is only about 20%.
Only 20% for
only
1
20%.
year.
And 90% of pancreatic cancer patients pass within 5 years.
So what do we do to protect ourselves?
We want to make sure that you have all the information that you need. So based on your research, what are the symptoms?
According to my research, there really aren't all that many symptoms for pancreatic cancer, unfortunately. Right. So from my research, it seems my research done from the American Cancer Institution, so reliable sources.
Yeah.
All of them have said that there really aren't all that many symptoms for pancreatic cancer. There may be some mild back pain, mild abdominal pain, and jaundice in later stages, but unfortunately at that point, it's usually too late.
Yeah, I actually opened up my kid's Davis Advantage pathophysiology textbook, and it said that the cancer expands and it impairs and obstructs the common bile duct.
Which would explain the jaundice.
Exactly, yeah, because it flows through the head of your pancreas, and the obstruction of that bile duct is what leads to that bilirubin backup within your blood, which causes the jaundice. Yeah.
Yeah, and that's the yellowing of the skin for the
Exactly.
audience at home.
I trust our research. We actually want to make sure that you're getting checked up by a doctor regularly. And speaking of, we actually have a doctor with us tonight.
Who?
World-renowned pancreatic cancer specialist, Dr. Beckman.
No way.
Yeah.
Oh, I'm so excited for this.
Gabe here from KGW9 Portland. And today we have Dr. Beckman, who actually works at the Phil Knight Pancreatic Cancer Clinic at OHSU Hospital. So what makes you so qualified?
Well, I graduated first in my class from Harvard, and then went to Johns Hopkins to do my residency, and then from there joined the OHSU team because of all the money.
Okay, I like it. So when a patient comes in with pancreatic cancer, what are the first signs you look for?
Well, Gabe, mostly I watch for nausea and vomiting. I also watch for the manifestation of Cuvier's sign, which is a palpable gallbladder due to the backup of bile in the abdomen.
Wow.
Yeah.
Wow.
This lack of bile, it should be flowing into your intestines, is backed up, so it can create clay-like stool.
Oh, okay.
So this bile backup can actually cause bile salts to accumulate in the blood, leading to pruritus and darkening of the urine. And that is one of the symptoms that I want your viewers to make sure that they understand. You could also find a left supraventricular lymph node. It becomes inflamed and is then palpable. That is something that I will look at as your doctor. And I would like to note that this is why it is so important for your viewers to visit their primary care physicians as often as possible. Because pancreatic cancer can be so asymptomatic, it is up to us to be able to spot the signs and symptoms.
Okay. Now, while subjective data is all well and good, and the things that you can see with your naked eye, such as that jaundice, or things you can feel, such as the gallbladder being inflamed, what are some of the diagnostic tests that you use to be able to diagnose this in patients, considering how serious it is?
Well, Gabe, there's few and far between exclusively pancreatic cancer tests. What we would look for is a blood test for the CA19-9 antigen, and that'll tell us that there's a tumor somewhere in your body, and then we'll narrow it down to the pancreas. We're also going to run liver function tests for AST and ALT. These are similar tests to what you might run for cirrhosis of the liver for people that have alcoholic liver disease. But I want to note that a real diagnosis is going to come from imaging tests like a CT scan or an MRI, and in combination with all of those things, we'll be able to give a good diagnosis.
What in the Grey's Anatomy? Well, this is very interesting, folks. I actually did hear that diabetes mellitus also affects your pancreas. Are they interrelated in any way?
You know, that's a really good question. They are related. Diabetes is a risk factor for all types of cancers, but they are not interchangeable. So you might have a tumor in your pancreas, but your pancreas would still be able to create insulin.
Okay.
Yeah, so it is rather confusing, and it may not be until a surgery is performed to remove the cancer that true diabetes would be diagnosed.
Now, it's kind of a jumbled mess down there. So if something's affecting the pancreas, does it also affect other things down there as well?
Yes, it does actually. So pancreatic cancer typically starts in the head of the pancreas, but it can also affect the stomach, spleen, liver, gallbladder, and some of the small intestine.
Now, what does that mean?
The cancer can metastasize to these other areas of the body, so it'll spread, and that can cause inflammation and distension in the diagnosis.
I experienced some inflammation last night after some Taco Bell. Could that give me pancreatic cancer?
You know, probably not, because you did eat Taco Bell. But I would like to note that lifestyle is an important risk factor in the development.
Oh.
I want to make sure that you're eating a diet low in trans fats, and that you're eating a diet full of diverse fruits and vegetables and high in fiber.
So basically, it sounds like this is a very deadly and hard to cure disease. So basically what I'm hearing is, are we all screwed?
No, because only about 10% of people are predisposed to the disease. But I would like to note that there is a treatment. There are two kinds. There's curative and palliative. We'll start with the curative part, which is in a Whipple procedure, the head of the pancreas, the distal bile duct, and some of the small intestine is removed, and that will hopefully remove the tumor. And then it is reconstructed to give you a semi-functioning bowel system. However, if this doesn't work in about 40% of patients, the cancer does return in a year. If at this point the cancer is no longer curable, what we'll have to do is start palliative treatment, dealing with pain, discomfort, and improving quality of life.
So even after your Frankenstein reconstruction, 40% of your patients still die? What do you even do? Are you getting a paycheck from big pharmaceutical companies?
Well, no, not at all. My job is to help the patients in any way I can. And if at a point after the Whipple procedure it becomes clear that it is no longer curable, we start palliative treatment. And that is essentially maintaining their quality of life, treating any pain they have, and decreasing their symptoms. And this would continue until, unfortunately, they pass.
I see. Okay.
Mm-hmm.
Now, when is it too late?
It's never too late, Gabe.
Okay.
I want to assure that your viewers that while the survival rates might be low, it is important that you understand that there is still hope for those diagnosed, and that we are here to provide the best possible care.
Thank you so much for coming in tonight. I learned a lot, and I hope that you all learned a lot as well about pancreatic cancer, how deadly it can be, and how hard it can be to diagnose.
Mm-hmm.
So thank you so much.
You're so very welcome, and I hope you guys have a wonderful night.
Welcome back to Fox 17. So Gabriel, that was very fascinating information, and very scary as well.
Huh?
Lots of big words. So just for me and for the viewers out there, could you break it down in more layman's terms?
Of course, yeah. So, you know, at the Phil Knight facility, they have a ton of diagnostic tests, fancy CT imaging machines, but what it really comes down to is if you're experiencing any vague or minor back pain, or if you're noticing any clay-colored stool, lack of color, or dark urine, you want to make sure you're going and seeing your doctor, because as Dr. Beckman said, a diagnosis from your primary healthcare provider is one of the first ways that you can identify this potentially deadly disease.
And from what I've heard, it seems that you may not always experience these symptoms, so it's important to get regular checkups with your primary care doctor, regardless of whether or not you're feeling ill or not.
Mm-hmm. And everybody's not the same. Everybody experiences those symptoms differently, and so again, we want to make sure we're going and seeing our primary care provider.
Wonderful. Thank you. Wow. That was a lot of information, and I feel much more educated. And I hope my audience out there also feels more educated and more aware of pancreatic cancer. Thank you for watching. This is CNN 12. Stay classy, San Diego.